me a little bit about how you came to this. What is your personal story? How did this happen? How did you discover that you're a psychologist?
I'm a psychologist.
And I mean, I'm a psychologist,
Right.
and I don't do brain therapy. I don't know what I do sometimes, but
You do this. This is part of what you do.
and I do talk therapy. I don't do scans.
Well, I started out doing talk therapy. I was a behaviorist long before behaviorism was considered standard and accepted, actually. And I actually started my career as a teacher. And I absolutely am passionate about children and passionate about teaching children, about children having full and happy lives. And I knew that there were some things that were kind of blocking them from that. So as a teacher, I moved into psychology. I got a PhD in psychology from Boston College, and I started seeing children, special needs children.
How
children.
come?
Why? Because I'm a kid person, and because it just, well, partly because it drew me, and partly because, I think because of my family history. In my family, when I was 7 years old, my father got encephalitis.
Oh my gosh.
And that was tremendously disruptive for him neurologically. He was never able to work again. My brother has Asperger's disorder. My mother has what we call the shadow syndrome, which is Asperger's but functional, as in, you know, I mean, she was a physician, which actually was perfect for someone with Asperger's, but she, I mean, I was the one, if you know what I'm saying. And I was also very passionate about children. I always loved children. I always loved learning. I was always very excited about that. Well, ultimately, I had my own children. And one of my children, when I brought her to school in 2nd grade, I was told that she had the worst ADD of anyone they had ever seen.
Oh my gosh.
And I should get her on Ritalin immediately.
Oh
She
my
was worse
gosh.
than the worst person on Ritalin. Well, I had a specialty in behavioral medicine, so that wasn't going to be the first place I went. That doesn't
And
mean
also,
I wouldn't do it. But
from what I know of you, you really enjoy taking a more natural approach to health, and you want to be holistic about it, so that must have been horrible for you to hear.
well, what it was a challenge. And I was on the board of directors of a group of professionals who did behavior therapy, and there was someone in my area that was doing neurofeedback. I knew because I was reading the newspaper, and I invited her to speak. And at the time, there was someone at McLean Hospital who was doing this as well. We were meeting at McLean Hospital.
And that's down in Massachusetts.
And that person was there also. And basically at that time, the technology was about, okay, it's going to take an academic year, and you're really not doing it for this year, you're doing it for the changes next year, and that sort of thing. So I took her for treatment, and I was very curious, and I wanted to know, well, would this be helpful for the kind of clients that I'm seeing? At the time, I was mostly seeing adults. And I wanted to know, does this help people with depression? Does it help people with bipolar? Does it help people with anxiety? You know, I'm asking all these questions.
And we know the answer is yes.
The answer is yes, absolutely. Well, what ultimately happened is this person left the area, and this other person wasn't doing it anymore, and there was no one around. So I went and got the training because my daughter started to lose her benefit. That doesn't happen in our practice. But
Well, how come
she wasn't
she
being
lost
seen
it
enough. She
and-
wasn't being seen frequently enough. And then this person said, take the summer off. We don't tell people to do that. Because this is a learning task. It's like learning a motor skill. So if you want to become a really good golfer or a really good pianist like your nephew, you're not going to practice every 2 weeks and then take the summer off. It's not going to work. You're not going to learn, and you're not going to get good at it. So that's not how we work. So I got the training, and it ended up not only helping her, but then it took over my practice. And then it took over my house, and then it took over my family, and it became a family business because it just grew and grew and grew. And my goal was to provide this service to whoever wanted it. So my goal was, okay, we're going to grow this business as much as the universe wants us to, without in any way jeopardizing the quality of our results.